Good morning, Megan. How are you?
I'm good, thanks.
So today you're here to have your breast implants removed after having had them for a very long time. Can you tell us a little bit about why you felt like you needed to have them removed at this point?
Yeah, I've just haven't been able to figure out why I was so tired all the time, even though I sleep a lot. I'm super healthy, super athletic, and I was having all sorts of joint pain. I was having actually allergies, a lot of allergies. My eyes are swelling, like for no reason. Short of breath every day for no reason. Just gone to a ton of naturopaths. None of them could figure out what was wrong with me. My blood work comes back perfect, diet's perfect, everything. Yet I feel terrible all the time. So it finally led me to Breast Implant Illness, which I did a lot of research on, and then found Dr. Bayati because she has it on her website, which a lot of plastic surgeons don't have it on their website.
Yes.
So you were one that I found that did. And now I have so many girlfriends that have done it and feel so much better after.
Okay. You know, this breast implant illness is a very new entity. I mean, it's been around for years and women have suffered in silence. But nobody really put a name to it. And a lot of women going to the different doctors were made to feel like it's in their head, which is not fair. And I've noticed that women have a hard time being heard by male doctors, by their own doctors, by their OBGYNs. They're like, you know, your implants look fine, they feel fine. And as a plastic surgeon who puts in implants, I had to keep an open mind. I had to actually be educated on it, and I had to see enough patients who have them removed and actually feel better. And having said that, you know, 90% of women who get breast implants don't have these symptoms. But the ones that do, I mean, it's a real entity and it exists and they need to be heard and they need to be paid attention to. And sometimes we work them up for autoimmune diseases. And a lot of plastic surgeons don't run that blood panel, but I do. And sometimes we find lupus, sometimes we find rheumatoid arthritis, other reasons why they're having joint pain, GI symptoms, fatigue, hair loss, all of the symptoms that kind of go with breast implant illness. But sometimes we find absolutely nothing. And of those people who we find nothing and we remove their implants, about 60 to 80% feel better. And it sometimes takes a week or two, sometimes it takes 3 months or so. And then the ones that don't, then the implants were not the cause. But there's no way to really know until you remove it and see if this woman feels better or she doesn't.
Right.
So again, it's not a universal thing about all people having implants, but people who feel these symptoms, there's solutions.
Right.
And blood tests to make sure there's no other autoimmune situation that you're suffering from. You know, workups. Sometimes women get to me after years of having gastrointestinal issues. They've had scopes, they have colonoscopy, upper GI scopes, they found nothing. Lots of orthopedic consultations. My back hurts, my neck hurts. I'm a young person. Why am I having so many joint problems? And sometimes they are just, you know, referred to a psychiatrist. They think they're malingering or they're just kind of like it's in their head, which is very unfair.
Right.
So tell me about how your husband feels about this.
Well, he's obviously not happy about the aesthetics of the situation. But I mean, he is okay with it. Like, he's ultimately like wants my health to be better, but yeah, he's definitely not super happy about it in the beginning until I just kept saying, like, I think this is why I'm not feeling well, so it's, for me, it's worth it. So
Was it hard to make that stance in your household?
yeah, kind of, but I'm that type. I kind of just, you know, stand up for what I believe in. So
I like that.
And my body.
Yes, absolutely. And if you feel like something's going to help you, especially as women who are raising daughters, you and I have talked about that. Sometimes we feel like we can't express how we feel because of the guys in our lives or because of how we were raised to just kind of go along with it. And I am very proud of you for basically standing up for what you believe. At this point, once we remove the implants, you're going to lose volume. In terms of your case, I'm going to just kind of give a little bit of the specifics of your case. Megan had very large implants for the amount of breast tissue that she has. So her breast tissue, she did this when she was young in college. And, you know, the girls are all going for these big implants and they were young girls. And of course, you know, that's such a trend. Over time, with having children, her breasts have thinned out. So right now it's just basically a very thinned out shell of tissue and skin over the implant. So doing a breast lift at the same time in her case would be risky because her tissue has been thinned out so much that if I take all of that implant, take the capsule that should come out with the implant in breast implant illness cases, then she will actually have some damage to the blood supply of the nipple and areola and her skin if I tighten it at the same time. So we're going to stage this for her. We're going to just remove it, let her body recover, see if she feels better, which we are hoping she will, and just wait about 3 to 6 months. Let her skin shrink and contract as much as it's going to, and let's see what she's left with. Options are fat grafting. We take fat from the rest of her body, kind of thin out the areas where she doesn't like the fat and put it in her breast. She's a very fit, lean girl. She has to gain weight for that. Or just have a breast lift and have nice, perky 15-year-old breasts without any implants. So those are options that are available to her, and she can decide whether she would like one or the other. Anything else you would like to add at this point before we go in?
No, I'm excited.
All right, we'll take great care of you. Thank you, Mira.